Elementary. Happy Tuesday. Good to see you again. It's Miss Davis. I'm here with your daily news update and also to talk about our topic for today, which is what is the coronavirus? What is it? How does it spread? What does it look like? What are all of these things people are saying? What does all of this medical stuff mean? So we're going to talk about that today. All right. First of all, what is the coronavirus? Why is it called that? Where did the name come from? Okay, so coronaviruses, it's actually not just one disease. So coronaviruses are just a big group of diseases that are all called coronavirus because all of those viruses have these little spikes on them that look like crowns. Okay, so it's like a whole family of viruses. Most people get them like pretty commonly. They usually cause cold-like symptoms, runny noses, coughing, slight fever, but usually nobody really gets hurt. There are certain diseases within coronavirus that can get really serious though. Okay, so some of those would be it causes respiratory issues, which means it makes it really hard to breathe. Okay, so your respiratory system is a system that allows you to breathe. So it's your lungs and your airways and your nose and all of that. Okay, so some of these diseases can cause bad things like infections in your chest and your head that lead to things like pneumonia, which is like a really, really, really bad flu where your chest gets all filled up and it's really bad. Okay, and they can cause all sorts of things. The coronavirus that you're hearing about is actually a new virus. Okay, so this isn't something that's been all over the place before, and this isn't like one of those other coronaviruses. This is a new coronavirus, which is why it's called a novel coronavirus. All right, and this coronavirus was first seen in China in December of 2019, and it causes, give me a second. Causes something called coronavirus disease 2019. Which gives us the name CO from corona, V from virus, and D from disease. And add those all up, we get COVID, COVID 19. That's where the name of this disease came from. It's just called coronavirus disease 2019 because this is the first time we've seen it, and so that's how they number things. Okay, so when we say coronavirus, that's more of like a general term for like all sorts of things. The issue right now is specifically this coronavirus, COVID-19. It's fine to call it coronavirus. Everybody knows what you're talking about. Don't worry about it. Just wanted to make sure that you understood the difference between just saying like coronavirus and saying like specifically this one. Okay? All right. Viruses, all right, are very, 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 very tiny little things. Okay, so a virus, so if you take the distance between your second and third knuckle, that's about an inch, right? Okay, so look at that and then break that into a million. That's how small a virus is. Okay, we can't even see it on regular microscopes. We have to use like special super duty, heavy duty microscopes to see all of these viruses. Okay, so viruses are very, very tiny. So they get all up in your respiratory system and they get all up in there. And then when you sneeze or cough, because like I said, this is respiratory, so it's all about your breathing. Okay, it's all about breath. When you sneeze or cough, those little droplets that you stick out when you sneeze or cough, you don't necessarily know that you're doing. You are, trust me. Okay, those spread, and that's how the virus gets from person to person. Okay, so that's why we say it's very, very important to stay 6 feet away from people if you think you have it or they could have it or you just don't know who has it, like strangers when you go to the grocery store, 6 feet away, because if they accidentally sneeze or cough or something, then that means you're not in range for all of their virus to get on you, okay? It also is very, very aggressive. So this is a very different kind of disease. Okay, it first popped up in China around December. Okay, so it's April now, so counting back. So we have December, January, February, March. We're not going to really count April because we're only 2 days in April. So 4 months, and 4 months, this disease has made it to almost every country, and it has gotten 800,000 people sick. Okay, 800,000. It's a lot of people. Okay, it's also caused a lot of deaths, which is why it's very important, which is why that's all you're hearing about on the news and all you're hearing about from people, and why you're not going to school and all of those things, because it's a very dangerous disease. Okay, so it's very, very fast spreading, very easy to spread, and it's very, very dangerous when you get it for some people. Okay, that's the important part. Some people will be fine. Some people will get it and get really sick, and that's why you have to worry about it. You've often heard that, like, oh, it's more like old people or people who are, like, already sickly are going to get it worse, and that is true. But also, like, younger people, like a lot of people in, like their 20s or teens can get it too, okay? So I want you to be really careful. It's not just something that you only have to worry about because of your grandmother. All right, it's something you need to worry about because of everybody in your family. All right, so, and I don't say that to scare you. I just say that so that you know when we talk about this, and especially tomorrow when I talk about social distancing, we understand that this is something that's serious. Okay, we can't just la-di-da. We have to really follow the guidelines, because it's very important that we do our best to be good citizens and not get everybody else sick because we want it to go around and play. Okay, we're going to have to just stay inside from now on. All right. This disease, this virus, also, they've checked it. The little virus, that little thing inside your body that makes you sick that we talked about, like I showed you the picture of the coronavirus, that can stay on hard surfaces for 11 hours. Okay, so for up to 11 hours, hard surfaces like plastics, metals, so like countertops, doorknobs, cars, shopping baskets, all of that can have the virus on it for up to 11 hours, which means if you touch it, you have it on your hands. And then if you have it on your hands and you touch your face, you have it in your face. If you have it in your face, then it can get inside your body, okay? Because your eyes, your nose, and your mouth are all places that viruses can get inside your body, okay? So you have all these wet, sticky places inside your body called mucous membranes, and they grab onto stuff and then they transmit it places, and we don't want that, okay? So that's why we talk about washing our hands a lot, because you could touch all of those things, and it's very important that you wipe those things down too, okay? Clean your house. Clean your house. Wipe things down. It's very important, because if it's not on there, you don't have to worry about it as much, all right? So you get it on your hands. And we all know we think we don't get our hands places, but we do. Like last time, remember last time you ate a big bag of Cheetos and then you had your hands all covered with Cheeto, right? You ended up getting it on your face, on your clothes, on your counter, on your couch. Your mom got really mad at you because you got Cheeto everywhere, because you touch stuff so much more than you think you touch stuff, which is why it's very important that we wash our hands. So when you're washing your hands, you have to do it for 30 seconds, which is a long time, okay? So that's like happy birthday twice. So one happy birthday, and then another happy birthday, okay? Or you can sing all sorts of songs. I mean, you can Google it, songs that take 30 seconds to sing, or choruses that take 30 seconds to sing, and you'll see that there's a whole bunch of really popular songs where you can get it, okay? So wash your hands. It's very important we get inside. We get on top, we get our thumbs, all right, we get our palms, and then if you have long fingernails, right now Miss Davis doesn't have long fingernails, even though she usually does, but if you have long fingernails, take either, I've been using an old, an unused toothbrush, I had an extra toothbrush, and get under your fingernails, okay, because you get all sorts of junk up in there, and it can also stay in there, the virus. Okay, the reason it's so important to wash your hands is because we are actually lucky that this is a different type of virus than some others. Okay, so there are two types of viruses. There are naked viruses, And then there are viruses that are coated, okay? So we actually have very, very lucky because we have an enveloped virus. So what that means is that little virus I showed you with its little crowns has coats, and it needs those coats to live. So it has one coat, and that's protein coat. And then it has another coat, which is a lipid coat, which is lipid means like fat. Okay, so it has two coats. All right, so here's our virus. Bad. And this is our first coat, the protein coat, and this is our second coat, the lipid coat. Okay, so we know what does soap do to fatty things, to greasy things, to stuff like that? It breaks it up, right? Okay, so when you wash your hands with soap, it disrupts this outside coat. Guess what? If he doesn't have an outside coat, virus dies. So that's why it's really important that you wash your hands with soap. Okay, and it doesn't need to be fancy antibacterial soap. Any soap will work. All right, because we know soaps disrupt the lipids, the fats. And so it breaks up the virus, and the virus isn't protected anymore, and it's dead. Okay, so very important, soap, everything. Okay, so now I'm going to talk about some of the symptoms. Okay, guys, I don't want you guys to get scared. Most of these symptoms also kind of work with other things, which is why they're saying, it's very important that you wait at home until you're really sure that it's very, very dangerous. Okay, so you can have a fever, you can have a cough, and you can have shortness of breath. Remember how I talked about it's all about your breath? Okay, because you can have a fever and a cough from all sorts of things. Okay, you can get a cold, you can get a flu, or you can get, allergies, or you just be allergic to something, or you just having a bad day. Okay, the very important thing is when it gets in your chest. Okay, that's when it makes the shortness of breath. Okay, so shortness of breath means it's hard to breathe. So like you can't take really deep breaths, like go, you're taking really short breaths and it's really hard to breathe. You're like, okay, if that happens, that's not a good sign. And I don't mean if that happens because you're running around with your friends. I mean if that happens if you're just, walking around. Okay, or if anybody in your family, if that happens to them, that could mean that you have the symptoms for coronavirus. Okay, so what also, all of the hospitals are going to be very busy from now on. The good thing is even if you have it, guess what? Most people don't have it really badly. Okay, so most people, so I'm going to make you guys a little pie chart. So most people that get it, okay, so about half the people that get it aren't going to have any symptoms at all. Okay, they're just going to have it. They're just going to have it. They're not going to feel bad. They're not even going to have a fever, no shortness of breath, nothing. They're just going to have it. These people can be bad because they can spread it, and we're going to talk about that tomorrow when we talk about social distancing. But right now, we're not going to talk about it, okay? So most people that get it, not even going to have any symptoms. All right? Other people that get it, big old chunk of other people that get it are going to have like a little symptoms. They're going to have sniffles, cold. They're going to, not feel great. You're going to have, like some coughing, but you're going to be fine. Okay? So if that happens and it's not like bad, you're just like, I just don't feel good today, don't freak out. Okay? First of all, you probably don't have it. And even if you do have it, it's probably not that bad. Okay? Because most people, look at that. Most people aren't going to get it that badly. The problem is there are some people that do get it badly. Okay? So we're going to break this in half again. Okay? So these are people that have it, it's not good. Like they have really bad fevers. They really just feel terrible. They really are having trouble breathing, but they're not like bad. Okay? Those people might need to go to the doctor. Luckily, lots of doctors right now, instead of having to go in because you don't really want to go into the doctor because other people that could be sick could be there. And so even if you're not sick, you could get sick at the doctors. I know, awful. So those doctors, like Scott and White and Caprock Health System, are two that I know for sure are doing something called Teledoc, where you can call in and talk to the doctor on the phone and like FaceTime the doctor, and he can look you over and ask you questions about your symptoms and all of that stuff, and you guys can decide if he really thinks that you need to come in and be seen, or if they can diagnose you right then and there and be like, okay, all you need to do is stay home, drink lots of fluids, and you'll, recover on your own. Or you can even do that like, hey doc, like I'm feeling bad for something else, or I have this weird like mark that I'm not sure what that's about, so that you can go in and get the doctor's advice on things without having to go to the doctor, because you don't want to go to the doctor for things that aren't related to that in case you do get it, because a lot of the hospitals and doctor's offices right now are going to be seeing those cases, and we want to leave all of the room for the people that need it. Okay, so remember this little bit of people that I said are really going to get it really badly? Those people need the doctor more right now, okay? So they need all of the hospital beds, and they need the doctors to be with them. So we don't need to go in if we're not that serious, because we want to save all of the room for people who really do need it. Okay? So we're sharing the doctors right now because we don't have a lot of doctors. We don't have a lot of beds. We want to make sure everybody that needs one gets one. Okay? So that's why, we're calling into the doctors for little things instead of going in like we usually would. Okay? Now, I know this has gone pretty long. I'm sorry. I'm usually not going to go this long, but coronavirus, to like cover all of it, it's a lot of stuff. Okay? I know. I'm very sorry. I promise this usually doesn't happen. But for those of you who have continued watching for this whole 16 minutes, here's your question. The plant right behind me, see that? See that plant? Tell me what kind of plant it is. Okay? In here. I'll even put it closer. What's this? All right. You can just tell me. Miss Davis, the plant that was behind you on your shelf is a what? All right. That's going to be your question for the day. Okay. Now, I'm going to really quickly talk to you about some news that's come out in Texas in the last day or two that could be important. Okay. So, Governor Abbott, remember, our governor, and the governor is the head of the executive branch at the state level. Okay, so he's like the president for the state, or like the mayor for the state. He's the governor. Okay, so he is the person in charge of the state right now. Okay, so Governor Abbott is actually going to have a press conference today at 2 p.m. and he's going to be talking with TEA, so the Texas Education Agency. He's going to be talking to somebody called Mike Morath, who's in charge of like all of the education in Texas. And so there's probably going to be something that comes out of that that's important for you guys. Okay, so I'm going to watch that news bulletin. I'm going to watch Greg Abbott's speech at 2 p.m. talking with the education agency. And if there's anything important for you guys, I'm going to let you know. Okay, it's probably going to be about the length of school closings. He might just say no school for the rest of the school year. He might, change the way we're doing online stuff. He might change testing dates. I don't know. But we are going to wait and hear from him, and then I will let you know. Okay, but that's going to be important for you guys. Education, school, that's what you guys are talking about right now. Okay? There has been a new executive order that increased flexibility with Medicare and Medicaid. Okay, so I know kids, you might not know what that means, but your parents, this could be important for them. Okay? That means that any prior authorizations that somebody got on or after March 1st are actually going to be extended further. Okay? So they're going to be extended further if you got them on or after March 1st. Also, any fair hearings and appeals, so if you're appealing for Medicare or Medicaid, or you have like a doctor's thing that you're appealing or something, that time is actually going to go from 90 days to 120 days. Okay? Now, there are other things in the order, but most of them are having to do with out-of-state people getting covered or stuff like that, or going to go see a doctor out of state. Most of you guys, you're in state, you're going to stay in state. That's not really as relevant to you guys. But if you want to know, you can just search the most recent executive order, not the most recent, he's had a couple, but the one about Medicare and Medicaid, and look at that, okay? We are going to go expanding hospital bed capacity. All right, so we are putting up hospital tents and making sure people, like, we're putting, multiple people in the same room so that we have enough beds for everybody, which is what I was talking about making sure there's enough beds for all the people that need it. So if you're not really, really sick, we need to stay out of the doctors for right now, okay? And once again, you can call into the doctors with Teladoc and you can talk to them and they can tell you, like, if you're really, really sick or if you need to come in, or they can even prescribe you something. They're like, oh, it sounds like you just have this, here, go. Because I know some people need to see doctors to get prescriptions refilled on a, frequent basis. You can call in and do that as well. Okay, so you don't need to go in to the doctor immediately. All right. We are also travelers to Texas from California, Washington, New York, New Jersey, Connecticut, Louisiana, Atlanta, Chicago, Detroit, and Miami. Those are a lot of hotbeds all across the United States. If any people travel to Texas from those places, they have to be in quarantine for 2 full weeks, okay? Because remember this virus? So the virus actually can stay in your body and incubate in your body for up to 14 days before it starts doing anything, okay? So it can be inside you and you can be spreading it around to everybody around you for up to 14 days before you even get sick. Okay, so that's why quarantine is that long. So that's why we're saying if you need to stay away and stay in your own bubble for 14 days, or stay with your family bubble, the people you already know what they do every day and who they interact with, 14 days to know, like, do you have it, do you not have it? And when you come into contact with somebody you don't know, or somebody if you don't know has it, that 14 days starts over again, okay? So that's what we're going to talk about tomorrow with social distancing. All right, but any of those people, so if you have family members, or maybe you went on a trip, like you went to Chicago or Washington or California, when you come back, you have to stay in your own bubble. Don't go out. Don't go talk to your friends. Don't go play. Don't go hang out outside and talk to your neighbors. 14 days. Okay, so a long time. I know, 2 full weeks, but we want to make sure that we don't bring it and spread it without knowing it. Because we wouldn't want to get people sick without knowing it. We don't want to get people sick knowing it either, because that's also a bad move. We want to make sure that we're doing our best to make sure everybody stays as safe as possible. All right, so sorry this got really, really long, guys. I know, I promise tomorrow I will be way more on top of it and I will cut it down, but this coronavirus package had a lot of stuff to go through and I wanted to make sure you guys got all of the information, so that you are well informed, so that when we talk about things tomorrow or further on in the week and I reference this stuff, you know what's going on, okay? So this was a big talking day, and the days after this aren't going to be nearly as long. All right, I'm going to sign off. It was great to talk to you guys. I miss you guys so much. Can't wait to get to see you again. I hope you have a wonderful Tuesday. Don't forget to message me, and you can just message me through Dojo Message. You don't have to really submit it through Portfolio because I haven't created an assignment for it. So just message me through Dojo regularly, like in your class. Just send it straight to me. What plant is behind me on my shelf? All right. Bye.